I'm Dr. Ed Baker, and today I'm interviewing Dr. John Auerbach, former health director in Massachusetts, for a research project that is being led by the Indiana University Fairbanks School of Public Health. The purpose of our research is to explore and better understand what it means to be a success as a state health official. John, thank you for doing this with me today. I'm looking forward to talking with you. John, thank you again for doing this conversation with me. Let's start out with success as a state health official. As you look back on your time there, what does success look like to you as you reflect back on your tenure as a state health director?
I think that the biggest indicator of success is being able to point to some sign, some concrete sign that health actually improved as a result of actions that I took in partnership with other people at the department. Ideally, that's improved health and some indication that people were healthier as a result of our policies or our programs. There may be other surrogate markers that are suggestive of success, but I think that would be the gold standard. I'd settle for a silver standard that had to do with improving awareness, knowledge, perhaps attitudes in some measurable way that were more supportive of public health or of activities that would promote health.
When you think about that, as you just described it, what factors in your mind contributed to that success? Not only perhaps your individual activities, but activities of others. What were the factors that really contributed to your success?
There were a number of factors that contributed to my success in that role. The first, I would say, is good fortune to work for governors and secretary who supported public health. I have to also say a state legislature. You can do so much more when you're in an environment where you receive funding for your work and where new and innovative ideas are received openly, if not always accepted. There's an open process for making the case. So I don't kid myself. If we had success while I was there, a lot of it had to do with the good fortune of being in the right political environment. That said, I think another factor was that I had already worked in public health for a long time by the time I was appointed to be a state health commissioner. I'd worked at the state health department for a decade. I was the chief of staff, I was an assistant commissioner, and then I'd left the state health department and worked for almost a decade as a local health officer where I had to address any health issue that arose in the largest city in the state. So when I came back to the department as a state health commissioner, I knew the issues, I knew the challenges, I knew many of the key people I was going to need to work with. That was very important. Third, I was very fortunate that I could bring with me a team of people I'd worked with already, or that I knew had the skills and experiences that we needed in order to have a successful tenure.
Wow. So you really had a lot of things lining up to help you succeed.
I was very fortunate.
What about, John, challenges? You've mentioned to me a major challenge that you faced during your term as state health director. What do you think what would be an example of the most really greatest challenges for you during your tenure, and how did you address that?
The biggest challenge during my tenure as state health commissioner was a result of the fact that I was appointed right before the recession hit in 2008. And that meant that year after year, the entire time I was state health commissioner, we were cutting the budget. In fact, we had 8 rounds of layoffs, 8. And each round of layoffs took months. And so it almost every single month that I was a state health commissioner, I was in the process of scaling back programs and laying people off. And that took a lot of energy, distracted us from the work we wanted to be doing to promote good health. It created problems within the department around the overall morale, so we had to pay a lot of attention to building morale. And it also meant that people needed certain kinds of creative skills to be able to deal with those challenges and still keep their eye on the ball about what were the key public health issues we needed to focus on. And I would say overall the team of people did an outstanding job, but it wasn't easy.
Wow, that's a huge challenge. Now, you mentioned coming into the job as state health director with a familiarity with the state health department and also having been the health director in Boston. So you were familiar with the territory, so to speak.
Yes.
But what do you wish you had known before becoming state health director that when you got into the job you realized, gee, I wish I'd known about this or that? Was there anything in particular that you said, gee, I wish I'd known about this before I became state health director in Massachusetts?
I had been in government for a long time, so you would think that I already knew what I needed to know. I would say, though, one thing I wish I'd known was, and known in a very deep way, not just known in my head, was that I needed not to take seriously either the good or the negative things people said about me. I think that you have to have a thick skin to do these jobs because you do take heat. You also get a lot of praise when things go well. And I think going into these jobs recognizing you're there temporarily. If things go well, people say nice things about you. If they don't go well, they say not so nice things about you. It's not personal. It's really about more than anything. It's about being in government. Just comes at a certain price. So I would say that was one of the things that I wish I knew. I also was coming back to the state government after having worked as a city health commissioner in Boston for almost a decade. When I was a city health commissioner, there was one person I needed to pay attention to if I wanted to change a policy or support a program. That was the mayor. As long as I had a good working relationship with the mayor, things clicked. Coming back into the state, I was struck by just how many layers I had to work through to accomplish anything. It didn't matter if the secretary, or in many cases the governor, also supported what we needed or wanted in our budget or for policy. We had to work with committees in the legislature. We had to work with so many different interest groups. It was a long, slow, complicated process to get anything done. And I think I would have appreciated being reminded of that early on, to be patient, to get used to working through all of those different layers, not to assume that if you get through a few of them, you're home free. You really have to have a strategic perspective about what does it take to get something done that recognizes its complexity.
It's a long-term view. It's really having that.
It's a long-term view, definitely.
Now, when you left the position, you were there for a number of years. You transitioned out. We're going to talk in a minute about things you're
Yes.
doing now. Transitions affect organizations differently. And so the question really here has to do with the impact of your departure on the state health department. You were there for a while. You've been, as you said, in the state health department earlier. What do you perceive was the impact of your leaving on the department itself?
Well, fortunately, I don't think my departure had a significant impact. Let me say that again. Fortunately, I don't think my departure had a significant impact, either negatively or frankly positively. I was there quite a long time. I was able to bring in a new cohort of leaders that played critical roles in terms of the department, and most of them stayed. And the policies and programs that we had put in place when I was commissioner largely stayed in place. The person who took my job after I left was someone I brought into the department and had a very close working relationship with. So I would say in general for the department, it was a smooth transition.
You've really answered, I think, my next question, which was how to mitigate any negative effects of transitions. As you know, sometimes in the role of the state health director, these transitions can be very abrupt, unanticipated. But say a little bit more about what you believe was in place, or maybe that you did, to mitigate the negative effects of transitions, because sometimes those can be, as you know, problematical. Say a little bit more about that, John, if you would.
My management approach when I was the state health commissioner was to work as a member of a team and to have a lot of shared responsibilities with the other senior members of the team. And I believe that made for a smoother transition when I left. There was no one needed to learn something that they didn't already know. They knew what the issues were. They knew what the relationships were like. They were ready to step into those roles. So I would encourage other commissioners to think about developing relationships with others in the department so that they are prepared and comfortable about stepping into the role of commissioner during a transition. I think a part of our role is to be a good mentor and to think about the long-term health of the department, and that really means putting together the team of people who will continue running the department and maybe stepping into one's shoes.
Let's come back, if we could, to something you mentioned earlier, because many state health directors come into a job without understanding, for example, how to work with the governor's office. You mentioned having it take a long time, and sometimes there are a lot of different players and actors. Help us understand better what you might call some best practices. You worked hard to develop those relationships with the governors that you served under, with their chiefs of staff, with those people in just the governor's office now. What could you suggest worked for you, perhaps? What could you suggest might be helpful to other people that want to strengthen their relationship with the governor's office in this job that you had?
Over the course of my tenure, both before being state health commissioner and after, I worked with 4 governors, 2 of them Democrat, 2 of them Republican. They were quite different leaders. So one thing I learned was you need to understand who's sitting in that office and what their priorities are and what their work style is. And you need to accommodate that. So I do appreciate that the governor is the one in charge, and our role needs to be assisting the governor in making the right decisions. Being flexible, that is an important part of the job. I've worked for governors, for example, some of whom who were micromanagers and others of whom who were libertarian. They felt like they didn't want to get in the details. They wanted you to figure things out. They just wanted there to be no negative stories. And it was important to adapt accordingly. So that was very important. I'd say another lesson I learned was patience with transition. We went through many different newly hired people in the governor's office, not the governors, but their staff. It seemed to us every 6 months there was some new, really young, inexperienced person who would be hired in the governor's office, whoever the governor was, that would call us up with a bunch of ideas and misunderstandings about what we did. And when that's happened several times, you begin to feel like, do I have to explain this all over again to another new person who's just entered government? And what I've learned was you do. You need to be really patient, and you need to take that relationship quite seriously and not express any frustration, but be well prepared to do a thorough briefing and accommodate the needs of the governor's staff.
One other thing you mentioned different from the governor's staff and the governor's office is working with the legislature.
Mm-hmm.
That's a whole different world.
Yes.
Say a little bit about your experiences there, because again, some state health officials have never worked with people who were in elected positions,
Yeah.
either in the state in state government.
Yeah.
What was that like? That's different.
I enjoyed working with the state legislature. The starting point, though, I would say, was that when I worked for different governors, they had different approaches to what a department head should be doing in terms of relations with the legislature. Some of the governors encouraged me to reach out to individual legislators and develop relationships and talk about my programs. I worked for a couple of governors who wanted legislative relations to be handled exclusively by the governor's office. So it was different under different circumstances. But I enjoyed working with the legislators. I enjoyed getting to know their staff. Their staff were often the key people that we needed to get to know. We paid a lot of attention to being responsive if we got a call from a legislator, if they wanted an answer. Once we got clearance from the governor's office, we tried to be incredibly helpful to them. We tried to answer quickly and accurately. We followed up with them. We wanted them to believe that we understood that we, in some sense, worked for them, and that we were well-trained, smart, and responsible.
Another key relationship, as you just said. Now, you've moved on. You've transitioned out of that position. You were at CDC for a while, and now you've moved into another position. And one of the things that you're involved in now, it seems to me, is around this area of thought leadership. You were leading an organization, and you've published and now begun to speak about this concept of the chief health strategist. In other words, someone in a position like the one we've been talking about, serving as a chief health strategist in this new era that people are describing as public health 3.0. You've written about this.
Yes.
Could you explain a little bit of what is meant by the term chief health strategist? And if someone were fulfilling that responsibility, what would they do?
Sure. The notion of chief health strategist is developed as a result of the need to think about the future. When you're in the role of a state health commissioner, many people consider it like drinking from a fire hose. You're essentially dealing with the emergencies of the day, the most urgent matters. You don't have as much of a chance as you might like to think about, where do I need to be in 5 years or 10 years? What's happening in the state over time in terms of some major trends? You can try to do that, but it's not easy. The notion of a chief health strategist was a reflection of taking some time to consider those larger trends nationally, and they're reflected in most states. They represent the changes that have taken place with regard to insurance coverage, how health services are paid for. They recognize the changing demographics, the changing environment with regard to data, and the shrinking of health resources in the public health sector. So the vision of a chief health strategist is one that moves away from the historic role of public health as being a safety net provider, providing really important clinical services, and in general moves more in the direction of being policy-oriented. It moves away from a focus on working with other people in public health or funded organizations that do the bidding of public health towards a partnership relationship with other sectors. the healthcare sector, transportation, education, and such. It creates a role of being a facilitator and a convener that can provide critical information, like data about the health of the population within the municipality, and like the evidence base for effective policy and programmatic activities. But it has an understanding that there are many other people at the table that are going to have their own interests and will be playing a role in terms of creating a healthier environment for the overall community. And public health can have an important role there, but it's really a partnership role.
One thing you mentioned is the need for better information and better data. So if someone moves in this direction of being a chief health strategist, there needs to be, I would presume, an infrastructure, information systems, information technology. All those things are trends that are moving very rapidly, as you know. What about that aspect of sort of the public health of the future that's important for people to think about in this age where information is sort of central to this strategic role? What would you say there for state health departments?
Well, a state public health department of the future needs to have a different approach to data than we've had in the past for a number of different reasons. The data that we have historically used is often old. It's often a year or two outdated, sometimes even older than that. It's often at a state level or a county level, not a granular level, hard sometimes to get subpopulation analysis. And it doesn't include important data sources from other sectors, from housing or from economic information or education information. So what we're encouraging people to do as they're thinking about the future is to utilize the best of traditional public health and try as much as possible to have those sources become more timely. We know death data, for instance, is much more timely than it used to be. And at the same time to access new data sources from healthcare as a result of electronic medical records and some possibilities of working with insurers, working with other sectors that exist that have an impact on health, be they education or economic sectors or ones that are related to transportation or housing. Pulling that data to get a fuller picture of what the conditions are in the community that help to shape overall health. And in addition to that, I think we need to be connected to the organizations that work in social media and are involved in our browsers. We need to think creatively about how to tap information that is related to the questions people ask on Google or information that they are putting out to the public on Facebook. There's more and more examples where creatively thinking about that kind of data can also be helpful for a state public health commissioner.
It's an exciting future. My last question, which you've touched on, is advice to those that would serve as a state health director. Final question, what advice would you give to someone that aspires to do the job that you've done as a state health director?
I would recommend a few things. One thing I would recommend is recognizing you hold the position for a short period of time, and that you have the potential to make a difference, pick a few priorities, work on those, and enjoy yourself. The second thing I'd say is have a support system. That can be your family, your friends, it can be your peers through ASTHO, but you need a support system. You need people who are there to help you think things through, to remind you you're a good human being on a really bad day, and also to keep you humble and remind you that if you're people are standing up and applauding you. It's really more about the position than you. You need a reality check from people who love you and care about you. And finally, I would say it's good to think about the future. Too many state health officials begin to think about what next at the point they're no longer a state health official. It's not easy to think about the future when you're in the midst of such an important role, but it's worthwhile doing that. And again, I think ASTHO and former state health officials who've made that transition can be very helpful in terms of helping think about what their transition was like, what their other career possibilities might be. You want to make sure that you're not caught by surprise and find yourself in a difficult situation at the end of your tenure.
John, great advice. Great talking with you today. Thanks so much for taking time to talk.
Thank you. My pleasure.